This is a study of 168 patients who had early stage non-small cell lung cancer at Brigham and Women's in Boston. And these investigators found that coronary calcifications were present as an incidental finding on CT scans in 70% of those patients. And more than half of them had no idea that they had heart disease. Despite having this cardiovascular disease risk marker present, however, a large percentage of these patients were not taking aspirin or statin. The conclusion of these investigators was that this omission represented a critical missed opportunity to try to lower somebody's cardiovascular risk. And, perhaps it's not really surprising. I suppose it's easy to get preoccupied when addressing a cancer diagnosis, right? Yeah, it's kind of all consuming. Right. And it's almost as if you're wearing blinders for everything else. This is well documented because we know that diabetics who are undergoing cancer treatment, that their diabetes gets neglected too. So their hemoglobin A1C numbers, get high because nobody's really paying attention to that. Everybody's focused on the cancer. I want to get back to the radiologists. They are now routinely mentioning coronary artery calcifications in the report. There was a big push to get them to include that, even when you're not looking for it. Even people now who don't have cancer, they're getting the low dose cancer screening CTs now too. And a lot of other studies too. There's a lot of other studies where you could easily adapt them to also screen for coronary calcium. We just have to do it. And there is some movement in that direction, because these are patients that is kind of right there if you look for it, and you need to treat those people. They are an important group to treat. Again, I wanted to mention at your next office appointment, you may want to ask your medical provider to pull up your last CT scan for review. And it's not that they have to pull up the images. They may say, well, I don't know how to read a CT scan. They don't have to read a CT scan. They just need to read the report.